My name's Zach Evans, I'm a second year student nurse at the University of Cumbria. So shared decision making to me means incorporating the patient's opinions and decisions as much as possible within trying to care for them and do what's best for them. So we have an approach as medical professionals what we think is best for them, but they also have an opinion on what they think is best for them. So rather than it being a one-way street, we want to turn it into a two-way street to get their feedback as well. I'd be open and as honest as possible. I'd use the evidence base that we have and put forward our opinions or our thoughts to them, let them digest it and then they can give us what their opinions are, having also had the same experience that we've had when we've explained it to them.
Do we guide patients or genuinely share?
I think it depends. Definitely most of the time it is guided. Especially when I've been in with consultants or doctors, they use their knowledge and then they try and guide the patients, which is fair enough. But I don't think it's a 50-50 split. I think if the patient has a stern opinion, then obviously we'll listen to their opinion, but that isn't all the time. Where I think a patient can definitely be swayed or guided, as the term you used, so it's not always shared, I don't think, no.
Can you give me any examples from your clinical practice?
So definitely surgery, where there's quite a complex surgery which is required. Most of the time the patient will accept that the consultant surgeon knows more about it than them, and they'll just say like whatever you think's best, and then that's the consultant guiding them which they think's on their best interest for a surgery that isn't always necessary or is not life-saving. Well, that's quite understandable. So that's the situations I've seen it in practice the most, is when it's major surgery involved.
What would you say the advantages and disadvantages are of true shared decision making?
I think the advantages, obviously, the consultant will 99.9% of the time know more about the procedure and the medical condition than the patient. And the advantage is that it will obviously help them get better or anything like that. The disadvantages are you're not incorporating the patient's decision, and if they have a really strong opinion on it, they won't be able to exercise that opinion if you're trying to force it or guide it upon them. So obviously most of the time the positives will outweigh the negatives, but there are some times where patients are obviously quite stern with their opinions.
And have you any examples in clinical practice?
Definitely on the meds round, quite a few different scenarios. So there's some scenarios where a patient will have dementia, and if you try and explain to them what the tablet does, they won't be able to understand it sometimes and they'll refuse it given their mood, which is understandable given the condition. But there's also times where someone might have done their own research, or they've took it before, they've had side effects that they're convinced is from that medication, and they'll refuse it themselves. And you can only do so much. It's trying to explain and reassure them about this medicine, but ultimately if they don't want to take it, we can't force it. We can't force them to take it. So there's definitely for dementia, and also from side effects or their own personal beliefs of medicine.
And what would your 3 top tips be around facilitating shared decision making?
Definitely explanation on behalf of a medical professional to a patient, because sometimes they do get confused when you're trying to explain something to them if it's quite complex. So definitely spend time, give them information, leaflets, websites, that sort of thing to inform the patient. And then spend more time with them, listening to them, because sometimes, in a busy clinical environment, you've not got much time with the patient, and they'll just say yes sometimes, when in the back of their head they're thinking, we need to speak to you about it. And also is trying to push this agenda or this movement, whatever you want to call it, so the patients know about it before they come in, rather, because sometimes patients come in with like an inferiority complex from a senior consultant, for example, and they'll be quite scared, when if they go in there with the perception that it is this shared care, then they might be a bit more on the front foot, talking about it or asking questions about it.
Any other tips?
That's it from me, from what I've seen. So it mainly focus around the patient side and the medical professionals. The medical professional needs to try and open up a bit more, and the same with the patient, try not to be as reserved, so you can come to some form of agreement.
And have you found yourself in a position where you felt you've needed to intervene between where a health professional's been going down the wrong road and at the furthest point from shared decision making?
I'd say initially no, but say if you're in a clinical setting, for example, and they're having this discussion and the patient's left the room and they've got loads of questions, sometimes they might say, can I ask you this, if they don't want to ask the consultant themselves at that time, and then you can take their question, then pass it on, and you can try and come to some sort of agreement. But not at the moment. Afterwards, lots of patients can come back with loads of questions that they've not asked, and you can try and find a meeting point between the two, but initially no, not in a clinical setting.
And that's something that is often that role that we have as nurses in enabling
Absolutely.
shared decision making.
I think it's a vital role. I think otherwise you're going to get one end of the spectrum for the other, aren't you? So that middle ground is absolutely essential, especially for the patient's best interest. Yeah.
Okay, that's great. Thank you very much.